Okay, so assessment for EKG. So before I go out to get the patients from the waiting room, I want to make sure that the room where I will be recording my patients' heart activity is cleaned and well prepped. By making sure the bed lines, linens, not lines, sorry, the bed linens are changed from the previous patients and that the EKG equipment are cleaned and ready to use. I will now call the patients to the back and introduce myself as hi, Miss Mohammed, I'm Rashida. I'll be your technician for today. Then I'm going to ask Miss Mohammed to verify her name, date of birth, and her social security number. Then I will give her a consent form for her to sign so that I can proceed with the procedure. I will then proceed to enter her what's that word demographic into the EKG machine. The information should include the name, the gender, age, and ethnicity. Explain the procedure to the patient by saying that the EKG purpose of that the ECG purpose of to measure the activity of the heart, and that the procedure is painless and doesn't require any injections. I would ask the patient if she has any questions pertaining to the procedure. Then I would give the patient a gown to put on and ask if she needs any assistance. If she does, then I will help her. If not, I would just step out of the room and let her get dressed. I would allow her a few minutes of privacy before I knock to go in. Before proceeding with the procedure, I will wash my hands with soap and water and put on gloves. This step is very important because it helps prevent the spread of infections. Before I stick on the electrodes, I want to prepare the skin so that the electrodes can read the heart electrical activity correctly. For standards lead, I will place lead I bilaterally one on the right arm and one on the left arm. Lead 2 from the right arm, I will place it 60 degrees downward to the left leg. Lead 3 from the left arm, I will place it 120 degrees to the right. For procedural leads, lead V1, the only electrical place on the right of the chest, placed on the right side of the sternum in the fourth intercostal space of the ribs. These words. Lead V2 is placed on the left side of the sternum on the fourth intercostal space of the rib. Lead 3 is placed on the left side of the chest, but electrocode is not placed on the body until after the lead V4 is placed, because lead 3 will be, ma'am, excuse me, thank you, will be positioned halfway between lead V2 and V4. Lead V4 is placed on the left side of the chest in the fifth intercostal space along a point of reference called mid-clavicular line. Lead 5 is placed on the left side of the chest. V5, that's what I just said. You said lead V5 is placed on the left side of the chest in the fifth intercostal place along a point of reference called the left anterior axillary line. Lead V6 is placed on the left side of the chest at a point of reference called the midaxillary. The fifth intercostal space I will then check to see if the electrodes are sticking to the skin. If not, I will clean the area with an alcohol wipe and repeatedly reapply the electrocode a second time. After the recording, I will check for any calibration. I will do this by checking the amplitude on the machine. I would also check for any interference by looking to see if there is any irregular waves patterns. To correct these correctables interference, I would check to see if my patient phone is off. Control the patient's movement and try using a lamp instead of a room light. I always want to check if any artifacts are present before I take the electrodes off of the patient's skin and correct it. Any interference I will report to the physician in charge of looking at the recording. Removing the electrodes, I will have to gently remove it because I can risk giving my patients a wound, so I will lift one side of the electrode and slowly pull it over itself. Then when I'm completely done, I'm going to explain to my patient that the physician will look at her recording and have a thorough result for her. I then will proceed to allow the patient to redress, and when she is done getting dressed, I will direct her to go out to the waiting room until her results are ready. Then I will give the EKG recording to the physician in charge of looking at it, and also document any interference that causes me to redo the procedure. As you can see, I'm very nervous, but I hope I did a good job. You have a good night.